So the first doctor that we talked to was amazing. She walked us through everything in plain language, told me exactly what to expect, encouraged all the questions, knowing that we were in a state of pandemonium. We were confused, we were upset, we were frustrated.
I mean, she stayed long after her shift had ended, just answering our questions, saying, I know you're in shock and, you know, your life just changed. You know, you knew it was going to change in a couple months, but it's changing now. And, you know, what can I do? What kind of advice can I give? Give me all your questions, and sat with us and was very, very encouraging. You know, the second doctor that took over was much the same way. It was very hands-on, and especially to me, saying, you know, what questions do you have as a dad? As, you know, obviously the focus is on her right now, but he took time to say, you know, what are you thinking? You know, you're important in this too. Like, what can I answer for you? One of the NICU doctors came down and actually took me to the NICU. She wasn't able to go in there. They weren't able to transport her, but they took me down to the NICU, gave me a tour, showed me where, you know, we would be taking him, what the process would be like after birth, where I could go, where I couldn't go. So, you know, these are doctors that we didn't know. It wasn't like the team that had been working with her beforehand. They were complete strangers, and they were wonderful. They were great. They were exactly what we needed at that time that we didn't know we needed.
And I think we also depended a lot on the nurses. So they were drawing blood for me every 4 hours. And so we were constantly asking, what's my level at now? What should my level be at? And then I said, well, why is my back hurting? And they said, well, we think your lungs are swollen. And so it depended on the nurses too. And they were monitoring how much fluid was emitting from my kidneys. And every time I would ask when they would check, I said, is it good? And she said, we're getting there. So we weren't shy about asking questions, and none of the nurses were shy about telling us what was going on. We brought them coffee and donuts one day because we thought, you know, you guys are being so accommodating to us. I think they knew we were frightened, and we just felt, you know, so, I guess, appreciative of how basically they've taken us in, and the doctors took us in as their own patients. That I told them, I said, you need to run and go get them coffee and donuts or something, because, you know, this is beyond what I would have expected.